your hearing is not working, then it is the vision which takes over the auditory part.
How common is that actually hearing is lost after that medication?
Usually you will develop your communication only if you're able to hear. A person might be hearing another person but not necessarily listening.
Thank you, Shruti, for joining us for this podcast. It's called Brain and You.
Thank you.
So, we have a lot of parents. Iyurved deals with lots of parents who have kids who are neurodiverse and neurotypical. And some of those children have some hearing disability as well. And because of hearing disability, you would know more than I do that there is a lot of impact that happens on speech and a lot of other development. So I would want to start by first asking you, what do you specialize in? And then I'll go deeper into asking you some questions.
Yeah, so I am primarily an audiologist. So I specialize in audiology. My master's is in audiology. I specialize in audiology. And I am a speech language pathologist too. Okay. But I specialize mainly in treating children and adults with hearing problems. So that is my specialization. So just to give a background, earlier I was working with Ramaya Group of Hospitals for almost 7 years. And then I joined Samvad as an assistant professor. So from past 3 years, I've been working in Samvad.
So what kind of age group of children come to you?
We have children from birth till adulthood, even geriatric population coming to us.
Okay.
Yes.
So what is it now that has improved in the area of children not being able to hear? How have things improved in the last couple of years?
There have been a lot of advancements with regard to the field of hearing in the couple of years. Like earlier, the only thing that was available to children was a body level hearing aid, which was a box type hearing aid with wires. That was the only kind of technology available to them. Other than that, it was sign language which was available. But now you have very sophisticated digital hearing aids. You have assistive listening devices along with the digital hearing aids, which will help them in a classroom setup, attending meetings, classroom setup, watching television. You have a lot of assistive listening devices for that. And you have even cochlear implants, very sophisticated cochlear implants, which has come into picture, where they can swim, they can go to extracurricular activities. So they have all the activities which is available for any other normal hearing person. They can do all of it with the access of technology. Music streaming, swimming, anything is available for them, because the technology is so advanced now.
Got it. So I'll tell you a story that happened in my family, and that was a very shocking incident for me. So a cousin of mine, she gave birth to twins.
Oh, okay.
And I'm talking about 14 years ago. At that time, I don't think we had as much of active hearing assessment. Because I remember when the kids were born, they were a bit premature. They were taken to NICU, where the doctor told the parents that, there are less chances of them surviving, so let's wait for 24, 48 hours. And in that meantime, while they recovered, they came home maybe after a month, everything happened, and they started growing. And they were twins. So what we realized, it was at the age of, I think, 3.5 or maybe more, around 4, is when the mother realized, or not realized, it was confirmed to her that your son cannot hear. And that is the reason he's not talking. So what happened was, because they were twins, he used to just look at his brother and copy. So imagine, he had masked his disability of hearing so well that whenever she would say, "Khana khane aa jao," he'll say, "Oh, where's the brother going? Okay, I'll also go. Okay, he's eating, I'll also eat." He was doing the same thing in school also. So it was in preschool that it was finally noticed by a teacher. So it wasn't that my cousin never went to the doctor. She could see things happening weirdly at home also. But I don't understand. This is what I want to know from you, that she went to decent doctors in Delhi, and this is Delhi that I'm talking about. However, nobody was able to diagnose that he is not able to hear. And I don't recall BERA being used that much. So what is the full form of BERA?
BERA is brainstem evoked response audiometry.
It's a machine.
Yes.
So I don't think there was a BERA test that time. So When the teacher responded and said there was music being played in the classroom and every child was told to just clap on the beat, he didn't know what he was doing. I think he missed the beat. Maybe he wasn't able to copy, or maybe he was asked to clap himself and he could not do it. That is when the teacher called the parent and said, I've been noticing for many days that whenever he's asked to do something by himself, he doesn't know. So is he a slow learner, or something doesn't seem right? Because the other boy had started to talk. This one wasn't talking. He was only pointing things. And it was then. And that was a very shocking incident for the whole family. Because how can we miss out on such a very basic gap in a child? Because I'm sure the child was going to the pediatrician regularly. But how could he miss this?
So many a times what happens is most of the hearing impaired children, they are very good with lip reading. So it's like you said, the brain is a wonderful plastic organ. So if there is some part of the brain which doesn't respond, then it's always the other part of the brain which takes over the function of that part. So if your hearing is not working, then it is the vision which takes over the auditory part of the brain and tries to compensate for the auditory loss. So many of the hearing impaired kids are wonderful lip readers, which you and me also might not be. So if I'm just given visual cues, only vision, only lip reading, only I'm just doing lip reading and you don't hear me speaking, you can't make out what I'm saying. But hearing impaired kids are very good at that. They're very good at reading lips. So if this child has been exposed that to a sibling who is absolutely normal, and if the child follows lip reading of the mother very well, then there is a very good possibility that you would have missed it out, unless and until it was a pure auditory activity that the child had to do, where he had to listen and then respond. So in the classroom setup, when the child had to listen to music and then respond to the beats, the child had a problem because it was a listening activity. It was not something which the child has to see and do. It was something which the child has to listen and do. That had become a difficulty for the child. So that's when they have noticed the problem. Otherwise, hearing impaired children are very good at lip reading. So even if they're not given any hearing aids, if they're prelingually deaf, when I say prelingually deaf, that means from birth. When they are deaf, there is a very high possibility that even without hearing aids, they are able to cope up very well. Because they are very good with lip reading. If you do this, then they are lost. If you cover your mouth, they are lost. Or if you keep your hands like this and talk to them, where you're covering your, making sure that your lips are closed, or you're not giving them the proper visual cue. Or a hair is falling on your face, or the person is heavily bearded or chewing and speaking. So that might be a little bit of problem for them to catch up, because they're not able to read your lips. But otherwise, they're very good with lip reading.
That's impressive. Okay.
Yeah. So that's the reason why this might have happened, is my guess.
And you shared that now this is not much of a problem, because BERA and the other test you just mentioned, what all tests have become compulsory now?
So now it's mandatory that you do, as soon as the child is born, 24 hours after the child is born, you're supposed to do a hearing screening test. So in hearing screening test, we have two tests that we do. That is OAE. OAE is the first screening test that is administered. The full form of OAE is autoacoustic emissions. So we have that test which is done, and that, if the child fails, is followed up with a BERA test. So these are the two screening tests that we do 24 hours after birth. If it is a NICU baby, then OAE plus BERA is mandatorily done. It has to be done. But if it is a well baby means the baby whose all the parameters are normal and is in a normal ward, then only a OAE test would suffice. Otherwise, if it's a NICU baby with a lot of risk factors, we always make sure that a OAE test with a BERA is compulsorily done before discharge.
How many cases, or is it a high chance or a low chance that maybe one of the tests can actually be done too fast or casually and the result may actually be wrong?
OAE test has a lot of false positives and negatives, because this particular test is affected by presence of noise, background noise. So it is very sensitive to noise. So if there's a lot of noise in the background, even in NICU, there's a lot of noise from the monitors, instruments, And in the well baby ward, there's a lot of people talking, doctors talking, nurses talking, so it's affected by noise. So if there's a lot of noise, sometimes it shows a refer result.
Okay.
So in that case, what is usually done is the child is asked to come back to an audiometric booth to do the testing, because an audiometric booth is a sound treated room or a sound proof room. So they are called there and we do the testing there.
Got it.
There also, if it shows similar results, then we always follow it up with BERA, because BERA is a foolproof test.
Got it.
It's an electrophysiological test.
And BERA is available in all hospitals
Yes,
now.
it is available now in all hospitals. If it isn't available, then usually these hospitals will have a tie-up with one of the
Got it.
audiologists or an
Got
audiology clinic where the audiologist is called and they do the
Got
test.
it. So parents should know as of today that their child will 100% get a BERA test
Yes.
when delivered in the hospital before
Yeah.
discharge.
Yeah. Not BERA, not compulsorily BERA, but definitely a hearing screening, that is a OAE
Got it.
test.
Got it.
Yes.
Okay, tell me one thing. Let's say now I'm talking about my cousin who delivered 14 years ago.
Yeah.
When did BERA or the other tests become compulsory in hospitals?
It has become compulsorily off late. I would say maybe the past few years, 3 to 4
Okay.
years, it's become mandatory. But before that,
okay.
no, it wasn't still mandatory. Because now you have, even in BERA, so earlier what was the problem is BERA instruments are very expensive, and it was a bulky instrument. With lot of wires being connected everywhere to the child. It was bulky. So if you have to take the child to a BERA test, you have to take the child from NICU to the room where the testing is done. There was no way that we could bring the instrument to the NICU to do the testing, because
Okay.
it was a very bulky instrument. But now you have screening BERAs available, which we call automated ABRs. We call it automated auditory brainstem response test. So you have just a small portable device, which is
Okay.
a screener which you can bring to the bedside and do the testing just within a span of 5-10 minutes.
Okay.
Again, the normal BERA test would require 1 hour, 1 full hour to do the test, whereas a screening BERA just takes 5 minutes.
Okay.
So that has come in the market, like from the past 4-5 years, it is available easily.
Okay.
So now it has become easier for us to do a screening
Got
BERA
it.
and give the results.
Yeah. Are there some indications also that a parent can keep in mind so that for whatever reason, he should not miss that my child has some difficulty in hearing?
Yeah. So just like we have something called motor milestones and something called speech and hearing milestones that every parent has to look for. Motor milestones, most of the parents are aware that they know that at 3 months the neck control has to be achieved. By 6 months the child should approximately 6 to 8 months the child should start crawling or moving himself on the floor in some way, either dragging on the stomach or crawling. Some kind of movement should be there. By 1 year the child starts to stand, and by 1.5 the child starts to walk. Parents are aware of this. But parents are not aware of the speech milestones or hearing milestones, so they don't pay too much attention to it.
Yeah. So what are those milestones?
So from birth to 3 months, usually the usual thing would be that babies respond to loud noises by startling, which is called a Moro reflex or a startle reflex.
Okay.
So as soon as a loud noise is presented, the baby immediately startles and wakes up and starts crying. Or there's a startle response which is seen. So it can be anything. It can just be a pressure cooker whistling to which the baby wakes up and starts crying, startles and cries. It can be a loud sound which has come from somewhere, or you produce a loud sound and the child immediately startles. So that is something that the parent should look for. Or familiar voices, the child immediately quietens down, like the mother's voice. Mother's voice is the most familiar voice every child is exposed to. So as soon as the child hears the mother's voice, the child quietens, becomes calm. Or if you're singing a lullaby, a soothing sound, then the child usually quietens. So these are the very obvious signs that you see from birth to 3 months.
Okay.
Then between 4 to 6 months, you need to look for, because by then the head control is achieved. So usually the babies will look for the source of sound in the lateral plane. Lateral plane means the child is able to turn towards this direction and this direction and make out that a sound has been presented. So if the mother is doing some chores in the room, like folding clothes and keeping it in the cupboard, and she's continuously speaking to the baby, and if the baby is on the bed, the baby will usually look back and forth, trying to track the mother's voice. That is something parents can look for. Or the child is very fascinated with sound making toys, like a cot mobile or a rattle. They will have a rattle and they will do this. They will shake it near their ears and they will try to hear the sound. They will also have some cooing sounds. Ooh, those kind of sounds they'll start producing. By 6 months, they would have started babbling. There's a proper babbling, the ma, those kind of babbling. You can make out the child babbling. Even if the mother is not there, by its own, the child will be doing a lot of babbling between 6 to 9 months of age. They will be babbling. If you're singing a sound, a rhyme or some kind of song, the child will actually pay attention. And they will also try to imitate you by doing the babbling.
Yeah.
And those kind of things become very evident. By 7 to 9 months, they're able to localize sounds from all directions. Up, down, anywhere the sound is presented, they're able to make out. You play games with them like peekaboo and all that, they will respond by giggling or by laughing. So simple games like that will start attracting them. Rattles, sound making toys, these kind of things. By 1 year of age, they will start responding to their name call. You call them by name and they will actually respond. They will respond to it. And then, they start saying words between 1 to 2 years. It might be simple words like mama, biki, or dudu, or gigi for water. So they start saying words like that. So those are the things that parents need to look for, which is called speech milestones. By 6 months, they start babbling. By 1 year, they start the first true word. True word means only when they look at their mother, they'll say mama. By 1.5 years, they'll start saying mama only when looking at the mother, not any random person. So that's called the first true word. Child starts saying that. So these are very obvious things to look for in a child. If the child is not doing these things, then definitely something might be wrong.
Got it. Is there also something called partial hearing, Shruti? So maybe that may confuse the parent that my child is hearing, or maybe hearing less.
Yeah. So we have something called acquired hearing. Acquired hearing loss. Acquired hearing loss is during the birth, things are normal. Okay, but after the birth, they might develop a hearing loss. It can be because of any infection that they develop it. Any kind of infection like syphilis, cytomegalovirus, any kind of infection, CMV, any kind of infection which has come from the mother to the baby. So they might develop the hearing loss much later.
So how and when do you develop such
so it might be after
infections?
2 years of age that they might be developing, they might be showing signs of hearing problem, or if they've had like a continuous infection of the ear, a middle ear infection, like a lot of discharge coming from the ear, frequent ear infections, and that has gone unnoticed. So later,
when you mention these infections, is there a particular event that happens when such infections can happen, or the milk goes inside?
No, it's not because of milk. These are certain bacterial infections which happen.
Okay.
And ear infection, like what I'm talking about is serous otitis media, otitis media, these kind of infections where you see a discharge from the ear, that should not be neglected. So otitis media is a middle ear infection which is very, very common in children. That can be, like you said, if there's milk which gets accumulated in the ear, or too much of dirt in the ear and things like that. There is a chance that the child always has a leaky ear. It is called a leaky ear in common terms. So if the child has a frequent middle ear infection, that is something that should not be neglected. It should be taken care of and sorted then and there, because that can later lead to an acquired hearing loss. Acquired hearing loss means they might develop a hearing loss much later. That can lead to a proper hearing loss, progress to a proper hearing loss.
Okay.
Or there might be certain syndromic conditions also which can lead to a progressive loss. Like it's not seen in the childhood, but later as the child starts growing, the hearing loss develops because of certain syndromic conditions which is there in the child. So those kind of cases are also there.
Have you come across any such case in your career?
Yes.
Where, the child was born absolutely fine hearing wise, but then the child developed partial hearing?
Yes. So we have come across many meningitis cases where the child is absolutely fine up till 1 year of age, 2 years of age, and all of a sudden the child develops meningitis. Meningitis in common terms is brain fever. So where the fever reaches the brain and then the child all of a sudden loses his hearing. Or supposing the child is under ototoxic medication. Ototoxic medication is medication which is given for very fatal conditions. Like the child is in NICU for certain treatment. It can be anything like a heart disease or a kidney, failure of kidney, where they're given certain drugs which is favorable to that particular part of body and which can cure the disease of that particular part of body, but it is toxic to the ears.
Okay.
So it will completely damage the ear.
Is this common?
Yes, it is common, and the parents are usually told about it, that we are going to give you an ototoxic medication, because that time what happens to the doctor is, it is important to save the life of the baby. Hearing becomes secondary to them. Okay. So they are told that to save the life of the child, we are going to give this ototoxic medication, but later the child might lose the hearing completely.
How common is that actually hearing is lost after that medication?
It is 90% of the cases they lose the hearing completely, and there is no way that you can reverse it.
And can this happen at any age or just with small babies?
No, it can happen at any age. It can happen at any age. So we have come across a lot of cases, especially meningitis cases, where the child loses his hearing, and usually it is progressive. Either it's a complete loss of hearing, or it can be a progressive loss where it's usually a mild grade and then becomes a severe kind of loss, and the child completely loses his hearing. So we have come across a lot of cases like that.
Okay. So coming back to the previous question, so if a parent knows that my child, or is kind of confused, at times that my child is hearing, but sometimes the child is not responding. So there is something called partial hearing, like you said, acquired hearing loss.
Yeah.
So what does the parent do in that case? Is there a way to absolutely be certain, or when should the parent get more worried to take the next step and say, I'm now certain that there is some issue?
As soon as the parent suspects that there is something wrong, whether it's a partial kind of loss with the child, they are like 50% sure the child might be hearing, might not be hearing. Whenever there's a confusion, it's always good to take help and get it cleared.
And in case of partial hearing also, BERA test results are 100% correct?
Yes, it is 100% valid. The results are 100% valid, because in BERA test, it tests the entire auditory pathway. From the external ear till the auditory nerve, the entire pathway is tested. And it's an electrophysiological test. Electrophysiological test means it doesn't require participation from the child. The child is just sleeping, and then the electrodes are placed at the various sites, and then the recordings are taken. So it is 100% foolproof test.
Okay.
Yeah.
So how does not being able to hear impact the development of the child? So when, let's say, a child is born with hearing impairment, how does the development or growth milestones, how do they get impacted?
So if the child, usually you will develop your communication only if you're able to hear. You respond to what is being said only if you can hear. If you don't hear me, then you will not be able to respond to what I'm saying. So it becomes very important that your hearing sense is fine for you to respond to what is being said. So if the child is not able to hear, all the language milestones go haywire. So the child will not respond to sound. That means the child is not going to babble. If the child is not, then the child doesn't say his first words. The child will not speak in phrases. The child will not take up any words. There'll be no sentences. So again, if even the initial stage, say till 1 year, they still couldn't make out. 1 to 2 years is a very crucial age, because 1 to 2 years is the time when you see a vocabulary spurt in children. Vocabulary spurt in the sense, at 1 year they might just be having, say, 2 words in their vocabulary. By the time they reach 2 to 2.5 years, they will at least have minimum of 100 to 200 words in their vocabulary. They will be able to say so many words. How are they able to say so many words? Because they see people talking. So if it is not English, in the regional languages, in the mother tongue, they will be knowing at least those many words, and they will be able to express in those many words. If the child is not developing vocabulary that rapidly, that means definitely there is some problem. It might not always be a hearing problem. It can also be a cognitive problem at times. But if you don't see that vocabulary spurt happening in the child, then definitely there is a problem, and you should take help. You should consult your pediatrician first, because the pediatrician is the first person that you go to, and then you should be directed to a speech language pathologist or an audiologist based on the pediatrician's recommendations.
So when a parent is told, let's say at birth, that your child is not able to hear, how soon do they start sign language?
Sign language. So in India, what we are trying to do is we try to discourage sign language as much as possible.
Okay.
We believe in integrating them into the normal society. So we try and teach them oralism. Oralism is
Okay.
trying to teach them to communicate like how other normal individuals communicate. So that is what we usually believe in.
How do you do that?
So what we follow is we usually tell the parents as soon as the hearing loss is diagnosed, please go to a hearing center and get a proper hearing aid or a cochlear implant done.
Okay.
So if the child, to determine if the child has a hearing problem, you have OE test, you have BERA test, and if it's slightly older child, you have something called VRA. VRA is done for children above 2 years of age, 2 years to 4 years of age. VRA is called visual reinforcement audiometry. Then there's something called pure tone audiometry that you do after 5 years of age. So these are various tests that we do to determine if the child is hearing properly or not. So through these tests, you get to know how much is the problem and to what extent is the problem, which is called degree and type of hearing loss. So based on that, you have very sophisticated hearing aids which has come up in the market, and you have implants which has come up for people who cannot be helped with hearing aids. So if the child is put the implant or a hearing aid as soon as possible, and you start off with therapy as soon as possible, the child can easily be integrated into any normal school.
Okay. I have a very basic question here before you move forward.
Yeah.
What is the difference between implant and hearing aid?
So hearing aid is a device which will help you to hear through the auditory mode.
Acha.
Implant is electrical signals which pass, and through the electrical signals you're able to hear the message which has been delivered. Hearing aid has its own challenges. Like if it's a child who has a very severe loss, a really profound loss, the child is having too much of hearing problem in both the ears. So hearing loss is in different degrees. You have like mild, moderate, then you have severe, and you have profound. Mild, moderate, moderately severe, that means up till 90 decibels of loss. So hearing loss is always graded in decibels. So up to 90 decibels of loss, if the child has hearing impairment, it can be easily rectified with the help of a hearing aid.
Okay.
But above 90 degrees, the hearing aid has its own limitations. It cannot really help the child listen so many things. Like speech sounds, the child might miss out on speech sounds. The child might listen to basic environmental sounds, but connected speech, the child might have difficulty following. In that case, we always say go for a cochlear implant. Because in an implant, what happens is, it is a surgical procedure where electrodes are implanted into the cochlea. Electrical signals are sent to it, which is interpreted by the brain, again converted into auditory signals, and that the child processes. So that is how an implant works. So it basically surpasses the external ear. Implants are, the electrodes are put in the cochlea, and directly the stimulation of electrodes happens. So that way the child is able to get all the speech signals too. So that is the basic difference between the two.
So you were telling about how you can get them included in the society through speech.
Yeah. So I was talking about that. So if they have the right kind of amplificatory device given to them at a young age, and side by side they have a proper speech therapy and or auditory verbal therapy which is going side by side, definitely they can get the normal course of speech. Like they will be able to develop speech just like you and me. And they can go to normal schools. They don't actually even require to go to special schools in that case. They can be integrated into normal schools and get into mainstream education. So in that case, sign language really doesn't come into picture.
Correct.
Yeah, sign language becomes mandatory if the person is not able to follow the oral communication for any given reason. Either because of financial reason, they're not able to procure hearing aids, any amplificatory device, they're not able to procure it, or there is because of any reason, they're not able to go for an amplificatory device, or they have been too late where it can really not help them much. Then the next course of action is to take them through sign language, because what we are looking at is to make the person, at the end of the day, the person has to be a contributing member to the society in some way. So then the next alternative is sign language. But till then, we would try and see if the oral way of communication is possible with hearing impaired children.
Got it.
Yeah.
So I have one question. I have dealt with a few parents
Yeah.
who have kids with hearing impairment, and the children are also autistic. Is there any connection between this?
Hearing impairment and autism, there's no connection. They are different disorders by themselves. Hearing loss can be a different thing, and autism is a different thing. Yeah, it can overlap.
Okay.
It can overlap with each other. Like a child might be having hearing loss, and later the child might develop autism, or the child might be having autism, and then the child
Okay.
might later develop hearing loss.
Okay.
Now, because the child is not hearing and the child has autism, the features might be even more, very evident, and it might be even more difficult for the parent to understand what to focus on, because the child has autistic features. The child also is not able to respond appropriately. Child is not able to hear, so it's like a complete a difficult circumstance for the parent. In that case, it's always good that they go to a proper speech and hearing center where they evaluate which features are more uh, uh, more
Prevalent.
uh, it's more valiant features, which is very salient features. They look for that particular features. Like for example, if autism is something which is more salient, then they will first try and work on those features. Like if the child is very hyperactive, the child is not able to sit, the child is just moving around everywhere, then they first try to rectify or bring those features to a particular level, and then they will work on putting in a hearing aid. Because we have seen many times, if a child has autism and hearing impairment, they will completely refuse to wear hearing aids.
Yeah.
They will have sensory issues, they will throw the hearing aid, they will have a temper tantrum, they will not like some device being put, they will not like the feeling of sound in their ears.
Yeah.
So they will respond very negatively to the device.
Yeah.
In that case, what we do is we'll first work on the autism part of it, try to bring them, try and achieve a little bit of sitting behavior, work through their sensory issues where they don't have a problem people touching them and a device being put. So we work on those issues first, and then we look at putting a device on them.
Okay. Have you
Yeah.
worked closely on a child who has a hearing aid or an implant
Yeah.
and also is severely autistic and hence is not talking? So how do you work on communication there?
Yeah, so we have a lot of children who have autism and hearing impairment, both, and we have tried to aid them. Like we have given them a device, and we have been monitoring how they are developing their language skills. Now, because there are two impairments which have come together, if it was solely a hearing impairment, getting them through oral mode of communication is little more easier.
Yeah.
Because no other modality is lost.
Yeah.
They're able to cope up better.
Yeah.
But since autism is also an issue which is come into picture,
Yeah.
you need to tackle those issues too. Now, coming to how successful they are developing oral communication might be a little bit of challenge for them.
Yeah.
Okay, complete oral communication, I will not say might happen, but maybe through rigorous therapy, yes, maybe they might be able to express certain basic, like they might be able to express needs of food, hunger, thirst. Basic communication they might be able to express, but a proper connected speech might still be a little bit of difficulty for them. In that case, we'll have to look for alternative modes of communication in their case.
Yeah. I wanted to ask you this next.
Yeah.
What are the different ways of building communication if there is no speech?
If there is no speech, then yes. If it's a hearing impaired child, then the next thing that we look for is sign language. We can try and teach them signs. Even with autistic children, many a times we have signs which we develop for them. Like if they want to go to the toilet, there are certain signs that they make. Or if they need to go out and play, they have signs. And if they want food, they have certain signs that they make, which can be very simple, like this. I want food. Or I want to go to play. They can do something like this for play. So, or help. I need help. So we show them these gestures, that you can use these signs to communicate with us. So that is one way of communication. Even if that is not possible due to either dexterity issues or something like that, then we always have something called augmentative alternative communication, where you have a communication board. Okay, so a communication board is nothing very complicated. It can be a simple kind of cardboard material where you have pictures stuck. So you have pictures of daily needs, you have pictures of routines, like what they do in the morning as soon as they get up. So you have pictures of routine, you have pictures of breakfast items, lunch items, dinner items. So you have communication boards like that, communication books, where they need to point to the picture and indicate what they want. So if it is breakfast, let's say it is breakfast, they're looking at breakfast, then you show them in breakfast these are the options available, the pictures are put there. So do you want poha, or you want upma, or you want puri? So they just need to point to the picture and tell you that this is what I want today, and you give them that. But again, to use a communication board, they will require training, because they will need to understand that, okay, this is the picture for puri, or this is the picture for upma, and I need to point to it if I want my need to be met. So for that, they will require some amount of training, but yes, that is another option that you can go for. You even have electronic versions of it, which is available in your gadgets. In your phones, you can download that. You can use even those kind of communication boards, or you can make your own communication board at home based on what are the communication needs of the child.
Got it.
Yeah.
One point that you touched upon was inclusivity.
Yeah.
How do you include such children when they grow up as adults? How do they contribute to the society? So you said it right. Sign language may not be understood by everyone.
Yeah.
Maybe just by the parents or by the teacher. So what do these adults, when they enter the workforce, firstly, how easy, how difficult, how reciprocative is the society, how accepting is the society, and what kind of careers do they typically end up doing? Those who are not able to communicate, what is it that what should the parents know about that?
Yeah. So if they are able to communicate, then they can get to the mainstream jobs which any of us get into. But if they're not able to communicate, we have something called vocational training. Vocational training is training them for vocational skills. Vocational skills can be anything like carpentry or welding or AC repair, washing machine repair, any kind of basic carpentry, electrical work, electrician work, or something which doesn't require communication. Like if they're interested in graphics, arts, media, web designing. So they are encouraged to take up those kind of things. So we have a lot of vocational training centers in India. Government run vocational centers itself, we have around 22 centers in India. So we always encourage them to go to these kind of vocational centers to take up a vocational activity. It can be anything which doesn't require them to communicate much.
These 22 centers you mentioned are specially for hearing hearing impaired children. Okay.
So there are these centers which is run by the government, where if they go, they will get vocationally trained based on their aptitude and interest.
What are these centers called?
They are called as vocational training centers itself.
Okay.
So if they go to these centers, based on their aptitude, they get trained. It can be anything of their interest. So if they are interested into graphic designing, they go into that. Web designing, they go into that. So they don't have to basically communicate much.
So this is interesting. So they will have trainers who either know sign language or are able to somehow communicate with these children.
Yes.
And okay.
So they can get into these kind of vocational activities, and they can take up jobs. And these vocational centers themselves will help them placing into the right kind of job. So that is the advantage.
Got it.
Yeah.
So if a parent has identified that my child is not able to hear, then now the child wears hearing implant or the hearing aid, what are certain activities that the child can do or an adult can do that can help in maybe hearing better or somehow improving your quality of life if you have this concern?
So like I said, the first key is for the parent to identify that the child has a hearing problem. And the second important thing is to accept that the child has hearing problem, because hearing impairment is still a stigma in our society.
Okay.
So it's still a stigma. Wearing hearing aid and implant is not as cool as wearing spectacles. So parents still have that stigma that, oh, ye dekhega yahan pe, there's a wire going from here to the, so it is very visible, a hearing aid is visible. So they have these kind of things which is there, and they try to cover it up. They try to cover the problem, and they don't come for help very soon.
Okay.
So the first important thing is identify and make sure that your child gets the right kind of device. So if the child gets the right kind of device, the next important thing is to take them for therapy. Very, very important. Because once the child starts wearing the device, the child needs to learn how to use the device. As soon as you wear a hearing aid, all of a sudden your world was silent. Now all of a sudden you're bombarded with sounds and you don't know what to do with it. I'm hearing everything together. I might be hearing the fan sound, I might be hearing a person speaking to me, I might be hearing the traffic. Everything is coming to me. Now a normal person knows how to do selective hearing. I know that if a person is talking to me, I need to pay attention to that person and try and avoid the other sounds. That my brain is wired to do. But with these children, the brain is still not wired to do that. So you'll have to teach them how to differentiate the various sounds. So it is important that they take therapy.
Got it.
So they need to take a rigorous therapy. So once that is done, then communication automatically happens. So,
and can, let's say somebody lost hearing for some reason at a later age, let's say 30 years of age. Or let's say, okay, let's imagine a scenario wherein we have a relative who is some 40, 50 years old now, and back then they didn't have any such good implants. But today that technology is available. But he has been a mute adult so far. Now if today that person goes and gets implant done, will he be able to get his speech?
Speech, see, if it again depends. If this person has been hearing all these 30 years of life.
No, let's say he was not
hearing. He was not hearing.
No.
And now he is going for an implant. Yeah, so he'll be able to hear the sounds. He'll be able to make out the sounds. But again, he will require therapy to make out the sounds. Because all this while it was completely mute for him. Now the sounds are falling in his ear. So he needs to make sense of it. So he'll require therapy. Communication might be possible for this person. He might be, again, it depends upon his interest, how motivated he is to learn to communicate. It even depends on that. But yeah, if he is motivated and everything, then yes, communication will be possible. But as good as how it was, how it would have been if it was from birth, might still be a question. It might still be questionable. He will develop communication. He will be able to express his basic needs and wants. But again, like complete discourses, sentences, dialogues might still be a little bit of challenge for him.
Got it.
But yeah, he'll be a functional member. He'll be able to make out all the sounds, environmental sounds, which is again very important. If he's driving, he needs to know from which direction the vehicles are coming. So those kind of sounds he'll be able to make out. He'll be able to make out if a person is standing outside the door and knocking. He'll be able to make out a telephone ringing. These are certain sounds we take for granted in our life. That this is something which is very normal. But these are very crucial sounds which is not heard by a person who has a hearing impairment. So if he will start hearing these sounds, he will be able to hear and listen to some music. All these things will be appreciated by him. Communication, yes, he will be able to communicate, but complete sentence discourses might still be little difficult for him.
Got it. So any very challenging case that you came across in your career?
With regard to hearing impairment, I will not say challenging, but we have a lot of success stories. We have a lot of children. I would proudly say in Samvad itself, we have a lot of children who have been implanted. And again, it's these children come from, they don't come from very high socioeconomic status. They come from low socioeconomic status. But through, NGOs and through a lot of other sources, we have tried to do the funding and get them a free surgery and get them an implant. And today they're doing wonderfully. They are in normal schools and they are speaking in complete sentences. They are able to integrate with normal children. They're doing excellently well academically. So they are like acing it in maths and science. Only difficulty they face would be in languages. Okay, like you have in schools, it's mandatory to have a first language, second language, and third language. First language is obviously English. Then you have second language, which is Kannada, and then there's a third language. That might be slightly challenging for them. It is little difficult for them to pick up, but otherwise they are able to really do very well in schools. We have had success stories like that where they're doing brilliantly.
And the reason you say it is difficult for them to pick up multiple languages because they're young. They're still learning how to do communication.
No, the reason is because whenever therapy happens, we try and do it only in one language. So since they're not exposed to any kind of language at all, we usually try and do it in one language. Either it is the mother tongue. If the preference is mother tongue, then it is mother tongue. Some nowadays parents tell us do the therapy in English from school point of view, because when they go to school, then the main communication there is English. So they say do it in English. So then we tell only if the parent is able to communicate with the child in English, and if everyone in at home is able to use English as a primary mode of language, then we'll go ahead with English as a mode of language.
Alright.
So since they're trained in only one language, shifting in multiple languages might be a little bit of challenge. Even for that, government has made provisions where they're exempted in their secondary and the senior secondary school examinations. They're exempted from taking languages. Parents should be aware of this and should take this from the government. It is a special thing which is given to these children where they're exempted writing second and third languages. And they should take this provision which is available for them, so that they don't have to go through the torture of learning the other two languages.
Got it. Okay.
Yeah.
So, what is it that one piece of advice that you always give to a parent who comes to you and says, my child is hearing disabled, he can't hear, or he has just been given a hearing implant or a hearing aid? What is it? Do they come disheartened to you, or do they come with a stigma to you? What is their expectation, and how do you make it real? What do you tell them?
Yeah. So usually the main challenge for us as parents will not accept the problem. So if the parents accept the problem, so we always follow the 1, 2, 3 principle. 1, 2, 3 principle is a principle given by the Joint Commission of Infant Hearing, JCIH. So it says, according to the Joint Commission of Infant Hearing, 1 month of age, as soon as the baby is 1 month of age, you identify the problem. By 2 months of age, the child is implanted or given a suitable amplificatory device, and by 3 months you start off therapy. If this is actually followed, the child can be as good as me and you in picking up communication. They can pick up multiple languages, they can go to normal schools. There's absolutely no hindrance. There's no hindering in the speech and language milestones which the child is developing. Child will do beautifully. But if most of the times this doesn't happen, most of the times the problem is identified very late, where the crucial age, the crucial critical age of brain development, we say is 1 to 5 years of age, where the brain is very plastic and it absorbs anything like a sponge, whatever is being told or whatever is being said. Usually most of the times in India, the problem that we see is after 5 years they come to us, when the child has started going to school. Where the school tells them that your child has a problem, so you either put the child in a special school or go and get help. Till then they don't come to us. By then it's very late.
Yeah.
So it is good that they identify and accept the problem early and come to us as early as possible, so that the therapy starts.
Absolutely. Yeah.
So once that starts, then integrating them into normal schools is really a cakewalk. Because we have seen lot of success stories where children are doing really well.
Yeah.
Really well in schools. So it is possible for all parents to get their children into normal schools. It's just that they need to come at the right time. As soon as you identify, bring them to us.
So as soon as they identified, they get an implant or an aid, plus they come for speech therapy.
Yes,
That's
very,
what you're
very
saying.
important. Yes.
What is the difference between hearing and listening?
So like I said, hearing and listening can be two different things. A person might be hearing another person, but not necessarily listening. For example, you are in a classroom where it's like a 2-hour talk or a 2-hour lecture. So you're just nodding your head, you're saying, yeah, pretending to listen, but you're just hearing. And if a question is all of a sudden asked to you, you're just lost. What did you say? You'll usually ask the person, can you please repeat the question again? Because you're hearing, that sound is going into your ear, but you have not made an effort to listen to what the person has said. So there are two different things. I might be hearing, but I might not necessarily be listening. I might not be processing it in my brain.
So is this like a real concern? Because that's what mostly kids do, no? When you call them,
No.
they can hear you,
No.
but they don't respond.
No, that is something called selective hearing that usually all the normals do. But in central auditory, there's something called CAPD, Central Auditory Processing Disorder, where the children are able to hear. So if you do an audiometry, they might get a very good audiograms. Their hearing might be in near normal levels. But these children might be having difficulty processing the information. Like they're able to hear sounds, but the brain is not able to make sense of the sounds. So they are problems like that which exist in children.
How do you identify such problems?
So usually there's something called so in the presence of background noise, they might have difficulty. Like if there's too much of background noise, the child might not be able to actually respond to what you're saying. Or if there's a speech background noise can again be two things. It can either be just traffic noise or normal noise, or it can be a speech babble. Like in a party, I'm talking to you, but there are a lot of people talking behind me. So then in that kind of situation, you might have difficulty really understanding what I'm saying. Normal people, what they do, they will come close to each other and they will talk, and they're still able to make sense of what is being said. But these children will literally struggle. They really can't understand what is being said. Or even in a classroom setting, the teacher is talking to them, they are able to hear her, but when she gives them a dictation or something like that, they might still not be able to take the dictation properly. So the teacher might just say that the child is not attentive in class, but it might not really be a problem of attention. It might be a complex problem like a central auditory processing disorder, where they are able to hear, but they're not able to attend and make sense of what is there. And usually this problem will exist along with a learning disability.
Okay. Yeah.
So it can exist along with a learning disability. So usually many of the learning disabled children are tested for a central auditory processing problem too, because it might just be a central auditory processing problem which might lead to learning issues for them. Yeah.
So this will easily go unnoticed.
Yes, there is a chance that it goes unnoticed till the child goes to school. Till then, it is not usually noticed.
And then also the child can just come off, the teacher can say, doesn't really listen, doesn't pay attention, and parents may just kind of ignore it.
Yeah, so we have that is always a challenge for us, because it always goes unnoticed and parents always ignore it for being not attentive in class, or just being lazy, or just not being interested in the subject. But sometimes it can be beyond that, and again you need to make sure that you do certain tests and see if there is actually a problem or
What
not.
tests exist to test this?
So for central auditory processing disorder also, we have a battery of tests. We have something called DDK test. DDK is dichotic digit test. We have something called dichotic CV test. We have something called SPIN, speech and noise test. These are all subjective tests which is available that we do to the patient and see if there's actually a processing problem that the child has.
So if a child has learning disability, it may be a good idea for the parent to get CAPD
Yes,
tested.
yes,
So once they get it
absolutely.
tested, and let's say it comes positive, the result
Yeah.
comes positive,
Yeah.
is there a way to fix it?
Yes, you have. So we see where exactly the problem is at the level of high. So when I talk about processing, auditory processing, processing always happens at the level of auditory cortex. Auditory cortex means at the level of brain. Processing doesn't happen at the lower levels. It's not at the level of ear that there's a processing problem. So that is why these children are always misunderstood, because they can hear everything. But it's just that they're not able to make sense of it. So making sense of it always happens at the level of auditory cortex in the brain. So we see where exactly they have a problem, whether it is combining two stimulus together and attending to it, or whether it is making we called it, we combining two things together and attending to it is called binaural summation. So we see if there is a problem with that, or whether they have a problem with integrating the stimulus, or is it that selective their auditory memory is affected. What exactly is affected, we look at that through the various tests that we have done, and we start focusing on that particular part and give them therapy.
Okay, so there is a therapy designed to fix CAPD.
Yes.
Oh, this is excellent. I think this will be very useful for parents.
So most of the LD children, we have seen that most of the learning disabled children, at least around 30% of them usually do have a CAPD problem also, which is there.
So once you start working on CAPD therapies, then you see the improvement in learning as well.
Yes, you will see an improvement in the learning disability. Unfortunately for CAPD, again, we don't have any provisions being made by the government, because they don't recognize it as a valid problem at all. So yeah, we have issues like that. Yeah.
Okay, very good. Anything else you would want to add?
Yeah, there's nothing else. I would just keep just focusing and reiterating the same thing. Identify the child early and bring the child early. Yeah,
Perfect.
that is the mantra. Yeah.
I think this has been very useful for me also, and especially for many parents of Ayurved who use Ayurved products, who are in touch with us, who have children who I think are wearing hearing aids and we're working with therapists. That's what parents tell us. They're working with therapists to build speech. So I hope they continue to do so.
Yes.
So thank you,
They should
Shruti.
be doing that. Yeah.
Thank you so
Thank
much.
you.